Hello, my name is Amelia Mitchell. I am a licensed massage therapist here in Maryland. I also hold national board certification and I have a specialty in lymph drainage therapy, manual lymph drainage, with a certification to work with clients up to the level of lymphedema, which is the most severe. That means I spend a lot of time during the day working with my client's lymphatic system. And I love it. It is a fascinating system. It is something that requires a very, very light and gentle touch. And because of the training that I received through Dr. Chickley, I'm actually able to palpate the flow. I can tell where the lymphatics are flowing in your system and help them continue to flow. And sometimes when things are flowing somewhat in the wrong direction, I can support the body in shifting that and changing and moving to a direction that is more conducive for health and can reduce swelling, edema, things like that. One of the places that I have been blessed to have a lot of experience over the years is working with people who have had cosmetic surgeries, breast mommy makeovers, a lot of tummy tucks, a lot of people post lipo, in addition to quite a number of people post facial surgeries, and even dental surgeries really falls into the same category. We're working with incisions, long incisions sometimes, hidden incisions sometimes, but there's been a lot of disruption in how the body goes about its business day to day, and there's also often a great deal of bruising. The lymphatic system is the magic weapon for all of this. How to heal things more quickly, how to reduce swelling and reduce pain, how to keep layers from adhering to one another. The lymphatic system is it. That is what does it. So working with it allows me really to support people who are recovering from such surgeries in a very efficient and helpful way. Nobody has a surgery to change something on their body because they love it. They have surgeries to change things because they're not happy with it for any number of reasons. And I really hold those choices and those decisions with absolute respect. I don't live in anybody else's body. I have no right to judge or think or question why they've made those choices. I'm here to help them heal. I'm here to help them feel better. And as a bonus, very often I can help people really understand their bodies better and understand the healing process more completely, which really allows for the whole thing to go so much more smoothly with realistic expectations. Very often going into such a surgery, the end result is the goal. And people very much pay attention to where they're going to. And this goal of the lipo and contouring some areas that don't seem to contour the way you want them to, the tummy tuck after multiple pregnancies and the belly just isn't coming back. I've seen a number of women who also had hernias throughout the process, so fixing all of this, that's the end goal. And time and time and time again, I see bodies get to that place. The in-between isn't always so much fun. The in-between after the surgery is often filled with, oh my goodness, why did I choose to do this? Oh my gosh, when is this going to get better? I didn't expect it to hurt so much. I didn't expect to be so tired. I didn't expect all of this swelling. Oh my God, the bruising. I can't let anybody see me. There's a lot that goes on in this in-between territory. And I've been holding that and walking with clients through that process for many years, and I'm very capable of holding that with a big heart and completely open-minded and no judgment. Everybody gets through the process. It's very, very rare that I see something where I need to say, Go back and check with your doctor about that. I'm a little concerned. Most of the time, things go very smoothly. And what I see is with the lymphatic work, the body is better able to heal. We're moving the fluid. We're helping the body repair all of that tissue damage. And it gets the body to a place sooner than it would have gotten to without the lymphatic work. So what exactly do I do? It's a hands-on therapy. It's incredibly gentle, so it doesn't hurt, which is really nice when you're hurting. It doesn't hurt. It's actually very soothing. It's very relaxing. It helps the body. I am stimulating the flow of the lymphatics. About 10-15% of the fluid in the body moves through the lymphatic system. And with these very gentle hand movements, I'm assisting the body in moving this fluid. I'm stimulating the flow. It's especially important in areas where there's been a surgery, lipo, where there's a lot of swelling. There's a lot of excess fluid in that area that has been brought to that area because of the tissue damage. It actually helps the healing if we can help cut down on the amount of excess fluid in the area. It's one of the reasons why most everyone is wearing compression after a surgery such as this, to keep the excess swelling from happening. So the lymphatics can take it a step further. So moving fluid out of the area, and by stimulating the lymphatics, we're also helping the body move all of those bits and pieces of tissue damage out of the area. Generally, you see that as the bruising. The lymphatics are who is responsible for removing bruising from your body anywhere at any time. So in a situation where there's a lot of bruising, getting lymphatic work can really help. Beyond that, it gets very specific about what I'm doing with specific clients in specific situations. A tummy tuck, very often the body has been really significantly changed. A new belly button has been inserted. There's a lot going on. So the body, the lymphatics no longer flow in the way the anatomy books say they flow, but that's okay. We follow along. We let the body do what it wants to do because it actually knows the best. So I support the body in moving the fluid how it needs to move the fluid to reduce it in the area and bring healing. The lymphatic system is also the home of your immune system, so all of this work is always supporting the healthy function of the immune system, which frankly helps anybody. So how often, if you had one of these surgeries, what would you need to do? How often would you need to come in? In general, I suggest 3 to 5 sessions, and that for the vast majority of my clients gets them where they need to be, gets them over this healing hump to a place of feeling much better about the process, about themselves, their body, and feeling like they're moving forward. On occasion, yes, I work with people more frequently, and on occasion, yes, I work with people less frequently. But in general, 3 to 5 sessions within about a week of one another works the best, and I've seen amazing results over the years. It's not a long-term process. It doesn't need to be. Now, yeah, there are people who end up saying, oh my God, I love alchemy. I want to be there. And they continue to work with us for a variety of other things. But for this process, for lymph drainage, for recovering from a surgery, 3 to 5 sessions is a pretty good expectation. Anything else from there? And I know that talking about this creates a dozen more questions. Anything else from there? I'm happy to discuss with you in person. Our first session is always going to involve a lot of intake. I want to know what's going on. I want to know all about the surgery, your experience with it, how it went, what's going on for you now, how you're dealing with day-to-day life. I want to know that stuff. That is really important so that I can best meet your needs with the hands-on session in the therapy. And there are always questions, and as best as I can, I've got answers for them. And if I don't, just tell you I don't have answers to that one. I enjoy working with the body in this way. I love working with the lymphatic system and how fascinating it is to be able to actually palpate how the fluid moves in the body and how the body responds to such things. And I've seen amazing healing over time. So if this is something that is going on for you, I welcome and invite you to come and see me at Alchemy. Again, I'm Amelia Mitchell with Alchemy Healing Arts Center, and thank you so much for visiting and learning a bit more about lymph drainage for cosmetic surgeries.